So good evening, ma'am. I am Mika B Academia, and for today's video, I will do the wound care. So before that, what is wound care or how you do wound care? So wound care involves every stage of wound management. This includes the diagnosing the wound type, considering the factors that affect wound healing, and the proper treatment for wound management. So once the wound is diagnosed and all factors are considered, the proper treatment facility can determine the best treatment options. So here, what are we going to do? First is to review medical orders for dressing change procedure. So after reviewing the medical orders, explain procedure to the client and instruct client not to touch the wound area or sterile supplies. So ma'am, I am your nursing assistant and I will do cleaning your wounds to prevent getting bacteria and infection, and also it also helps speed up the healing process with less scarring. So ma'am, please not to touch your wound to avoid getting any bacteria. So the third step is to close the cubicle curtains and windows. Then position client comfortably and drape with bath blanket to expose only wound site. The next step is to place waste receptacle. So we have here waste receptacle within reach of work area. The next step is to apply face mask and protective eyewear if required, and wash hands thoroughly. The next step is to apply face mask or eyewear if required and wash hands thoroughly. So we are now done washing our hands. The next step is to remove tape, pull parallel to skin, pull forward dressing, and remove tape, bandage, or ties. With glove hand, carefully remove gauze dressing one layer at a time to taking care. Then if dressing sticks on a wet to dry dressing, do not moisten it. The next step is to observe character and amount of draining on dressing and appearance of wound. So this is where the wound. The next step is pose a soiled dressing in a waste receptacle. Then, remove gloves by pulling them inside. Out and dispose in work receptacle. So, we have here the dressing tray, waste receptacle, and other equipment. So, in dry dressing, the first step is to open the bottle of solution into sterile basin and pour it into sterile basin. The next step is to put sterile gloves. So we are now done putting our sterile gloves. The next step is to inspect wound for appearance, drains, damage, and integrity. So avoid contact with contaminated material. Cleanse wound with solution. Use separate swab for each cleansing stroke Clean from the less contaminated area to most contaminated area. The next step is to use dry gas to swab in some manner as to step 16 for to dry. The next step is to apply antiseptic ointment if ordered using same technique as for cleansing. So the next step is to apply dry sterile cleansing to incision or wound. Then place it to waste receptacle. The next step is to apply loose women gauze as contact layer and 4x4 gauze flat to fit around drain if prevent. Pre-cut gauze is also available. Apply second layer of gauze. Then apply thicker woven pads. So after that, gonna put So, for wet-dry dressing, first is to pour prescribed solution to sterile basin and add fine mesh gauze. Then the next step is to put sterile gloves. So, after putting sterile gloves, inspect wound for color, character, or drainage type of suture and drains. The next step is cleanse wound with prescribed antiseptic solution or Normalin. Then apply most fine gauze. Single layer directly into wound surface. Then apply dry sterile 4x4 gauze over wet dry gauze. Then after, apply tape over dressing. After putting tape over dressing, Remove gloves after and dispose into waste receptacle. After assist patient to comfortable position, and dispose of supply and wash hands after. So we are now done doing the wound care. Thank you for watching.